Hi, I'm Dr. Kurt Woeller. I'm often asked, how long does my child need to do a diet, such as the gluten casein-free diet, or how long does my child need to take methyl B12 therapy, or how long does my child need to do a particular other therapy, whether it's dietary therapy or supplements. And it's a very difficult question to answer because each kid truly is an individual. I wish we could say that we could implement these therapies straight across the board and get 100% improvement 100% of the time with all kids. It's just not the reality, and to be honest with you, that's just not the reality with anything in life, and specifically it's not the reality with anything in medicine. Okay, there's always a certain level of uncertainty with different types of therapies that are implemented, and there's always a certain level of non-responders to any particular type of therapy. However, with the majority of biomedical therapies that are available, the things that have stood the test of time, the things that have been around now for many, many years, these things tend to work in great percentages for a wide variety of different kids from all shapes, sizes, and ages. And more importantly, from my experience, they're very, very safe when you compare them to many of the traditional medications that are used. Specifically something called risperidol, which is the main medication that's actually FDA approved as a treatment for autism. When you're talking about dietary intervention or nutritional supplements or methyl B12 therapy or treating yeast or bacterial issues that are quite common with individuals on the autism spectrum, they're incredibly safe compared to many of the pharmaceutical medications. Now, that's not to say that some kids or teenagers or adults who are on the autism spectrum may not need a medication from time to time, because clearly behavioral problems, learning difficulties, attention issues can certainly be quite problematic, and sometimes medication is needed. But in many cases, medication isn't needed, and so actually implementing a variety of different treatments can make a world of difference. Why is the gluten casein-free diet, for example, been around for so long? Well, the main reason is it works. It works for a large percentage of individuals. Not for everybody, certainly not, but it works for a good 65 to 70% of those kids, at least what I've seen in my practice, and I know other doctors around the country have seen the same results by just implementing that diet alone. Okay? Supplement therapy is important because what you're doing is you're filling in those gaps nutritionally. Whether it's B vitamins, whether it's essential fats, whether it's zinc or other types of mineral or vitamin deficiencies, when there's a deficiency, you want to replace it. You want to supplement for it. And many kids on the spectrum have very limited diets. They're not getting the nutrients they need. So it's really a no-brainer that you'd actually want to use specific supplements to help support some of those underlying needs. I actually have a very informative website at autismsupplementscenter.com. And on this website is a whole host of videos that I created that talk about different types of supplements that are very helpful for individuals on the autism spectrum. And that you can actually break the things that are broken down into categories too. So you can look up what remedies are helpful for hyperactivity, or what remedies are helpful for sleep problems, or what remedies are helpful for constipation. So there's a lot of information that you can access on the internet. I've created a tremendous amount of educational material. I also do webinars through GreatPlainsLaboratory.com on a monthly basis where I work through different topics related to biomedical intervention. Okay, so please, investigate, open your mind, take the time that's needed to actually help your kids, because there's a lot that you can do to help your children improve in their quality of life. Thanks.